What's up? Sammy here again. I have a little note to put in trigger warnings, which I've kind of forgot about doing, maybe. But trigger warnings for trauma, possible cussing, because I like to cuss. But again, little side note, if you feel like you're going to be triggered or this is going to cause harm to you, please just don't watch. Like, or if you can, just mute it and read. Whatever works. But today we're going to talk about dissociative identity disorder versus otherwise specified dissociative disorder, or DID versus OSDD. Now, for both of them, kind of how it works. When we are born, we don't have distinct identities or personalities, whatever word you want to use. When you're born, basically all you can do is scream and cry and eat and poop, and that is about it. But as you get older, you know, their identity kind of starts to form. They know what they like, what they don't like. They can voice their opinions. They know how to get up and get their own food, etc. And that is typically around the ages of 5 to 9. Some of the literature has a little older, some has a little younger, but this is about the average. However, during this crucial age period, if harsh and or repeated trauma occurs, the brain will one freak out, but because it's freaking out, it'll go, what do I need to do in order to stay alive? So how it does it is in most cases it is called this amnesia wall. It pretty much separates the child from the trauma in an attempt to protect the child from what's going on. Now, because of this, that's where you get that split. There's a wall now. It'd be like if you take a piece of paper and you rip it apart. So you now have more than one personality state in this one body. And the whole point is to allow the body to live as normal of a life as possible with little to no memory of the trauma that happened. And that is how it works for DID and OSDD. Now, for DID, it is characterized by 2+ personality states. These personality states are caused by trauma, which we talked about earlier. These personality states are as diverse as people. Now, when I mean diverse as people, I'm talking about in a single body. If the body is presenting as male, they can have a female alter. They can even have a non-human alter. They might have, someone who is Asian, but the body presents as African, or maybe just Native American, or white, or insert thing. And with that, amnesia separates these personality states. So for the most part, they have no idea about the other one or the other parts. Now, with OSDD, you have two types, 1A, 1B. 1A, you have 2+ personality states. Personality states are, again, caused by trauma. However, with OSDD 1A, there is little to no distinct personality states. So how it's kind of described is you have the single personality, but it's that personality in multiple different age forms. So you have someone who is like 3 to 5, 10, 12, whatever. But they're all kind of the same person, just at different ages. And thus are at different knowledges. However, there is amnesia present between these personality states. So if you want to think about it, it is basically DID minus the distinction between these personality states. And OSDD 1B, again, 2+ personality states. These states are created by trauma. These have distinct personality states that are just as diverse as people, but there's little to no amnesia present between these personality states. So you can kind of think about it as DID minus the amnesia. Now, yes, these disorders are very similar. However, they do have those few differences where DID has amnesia and distinct personality states. OSDD 1A does not have the same distinction between the personality states, but has amnesia. And OSDD 1B has distinct personality states, but does not have amnesia. Someone can have DID or OSDD and not know it. That's kind of the whole point of these dissociative disorders. They dissociate out of the trauma of what's going on. So, one, they don't know that trauma happened in the first place. And so they don't realize that it's happened. People cannot randomly form alters in adulthood. Like, they can't have basically the perfect childhood, no trauma, and then just one day, oh, I have DID. Not how it works. However, if their personality was already, quote, fractured during childhood, like they had that childhood trauma and, they just had no idea about it, yeah, later on, they can find out that they have DID and another alter form. That's perfectly fine. And again, I'm glad Lena put this in here. You cannot diagnose somebody. We're people. We are not trained professionals with mental health disorders. So no, you cannot go around and be like, oh, this person has DID, or oh, this person has PTSD. Oh, this person has anxiety. Oh, this person has this. No, can't do it. Only a trained professional can do this. And on top of that, even more, do not force anybody to tell you about their trauma. One, they don't have to. Two, it's none of your damn business. Don't. And this includes people who have DID, OSDD, or some other thing, or have just experienced trauma in general. They don't owe it to you. Don't force them to do that. If they do have trauma, all you're doing is causing them more pain, which in my own existence would make you kind of a shitty person. So just don't do it. And that's kind of it for this. If you tune in, not next week, but the week after, we will be talking about our DID/OSDD mini-series, which we kind of go more in depth. I have no idea what order we're going to do it in, but we're going to have that mini-series next. Thanks and peace out.